Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. More states flag off second phase of vaccination exercise. Coalition of CSOs in Edo State get injunction against planned restrictions aimed at the unvaccinated. A new COVID-19 variant, which appears to mutate faster than other global variants, gives South Africa's scientists cause for concern. 460 new cases were reported across 12 states and the FCT last night. The breakdown shows River State reported the highest figure of 164 cases, while Lagos State came second and Edo State third. Here's more on the virus update.
The latest data from the Nigeria Center for Disease Control shows that the daily infections in the last 24 hours are 460, amidst the spread of the Delta variant in the country. The latest figures were reported from 13 states and the FCT, indicating an increase from the figures reported earlier. Rivers topped the chart with 164, followed by Lagos with 139. 61 cases were recorded in Edo, 37 in FCT, Bayelsa had 20, Oyo had 14. 7 cases were registered in Plateau, 6 in Ogun. Anambra and Benue reported 4 cases each. Enugu had 2, while Cross River and Kaduna registered 1 each. There were 0 cases reported from Borno, Ekiti, Nasarawa, Ondo, Osun, and Sokoto. The overall count of confirmed cases in Nigeria now stands at 191,805. 209 people have been discharged in the last 24 hours, increasing the total number of recoveries to 178,492. The NCDC also reported 1 additional death from complications in the last 24 hours, raising the fatality toll to 2,455. Presently, there are more than 10,000 active cases in Nigeria, while over 2.7 million samples have been tested. In Africa, there are more than 7.7 million confirmed cases and over 195,000 deaths have been recorded across countries on the continent. The total global confirmed cases now surpass 217 million, while more than 4.5 million deaths have been reported.
The federal government says it will consider stricter measures to contain COVID-19 vaccination hesitancy once vaccines are made available to all governments and corporate entities in the country. The Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shoaib, stated this at the bi-weekly news conference in Abuja to give an update on the country's COVID-19 vaccination exercise. According to him, citizens have a right to accept or reject the vaccines, but the government also recognizes that those who have been vaccinated also have the right not to be infected by others.
We would like to encourage governors to continue to provide leadership in the mobilization of citizens to prioritize the acceptance of the COVID-19 vaccine. We are particularly enthused by the example shown by the governor of Edo State, His Excellency Godwin Obaseki, as he mobilized churches and religious leaders towards mass acceptance of the COVID-19 vaccine. The Presidential Steering Committee and the Federal Ministry of Health is exploring ways of making vaccines more available to all Nigerians, including federal civil servants and corporate entities. Once these vaccines are made equitably available to all Nigerians, then we will have to have a frank discussion about justice, fairness, and liberty that exists around vaccine hesitancy. If some individuals refuse to take the vaccine, hence endangering those who have or those who could not due to medical exemptions, then we have to apply the basic rule of law, which stipulates that your human right stops where mine begins. So you have a right to refuse vaccines, but you do not have the right to endanger the health of others.
Meanwhile, the Kwara State government has flagged off the administration of the second phase of AstraZeneca COVID-19 vaccination exercise in Ilorin, the state capital. The Commissioner for Health at the Primary Healthcare Center has asked members of the public to discard conspiracy theories relating to the vaccines. Meanwhile, in Enugu State, the government received over 70,000 doses of the AstraZeneca and Moderna vaccines from the federal government, flagging off the second phase of the exercise.
More states in Nigeria appear to be ramping up their vaccination drive to stem the third wave of infections in the country. The Kwara State government has taken delivery of 12,900 AstraZeneca COVID-19 doses for the second phase of the vaccination exercise. At the flag-off ceremony at the Primary Healthcare Center in Ilori, the State Commissioner for Health says Kwara lawmakers have received their jabs to encourage the uptake of the vaccines by residents. He also dispels myths around the safety of the vaccines.
It's safe. The misconception about the site is magnetic, people will die after 2 years, is not true at all. That's just fallacy. It's very safe.
The executive secretary of the State Primary Healthcare Agency allays fears of possible side effects from the vaccine.
We're likely to have, people coming back with mild-grade fever, pains at the site of infection, at the site of vaccination, and these are normal reactions.
In Lagos, at some of the centers monitored in the Ojodu area of the state, residents came out as early as possible to be certain to get vaccinated, claiming the process is on course despite some hitches recorded earlier in the day.
I've always wanted to take the vaccine, but I was scared because of the crowd coming here and meeting the whole long queue. So that's what has been holding me back up to now. But I feel good I've taken it. Well, I encourage everyone to take it. It's better to stay safe because COVID is still pretty much out there.
Well, it's been a nice experience because I actually registered online to be at the afternoon session, and we came in here in the afternoon precisely, and I'm amazed to see that the system is running smoothly. My wife has taken it over the last 1 month, so there's nothing to be worried about.
Over 70,000 doses of AstraZeneca and Moderna vaccines have been delivered to the Enugu State government. While flagging off the event, the state deputy governor emphasizes the need for residents to consciously follow the non-pharmaceutical precautions to keep the rate of infections at bay. The vaccination program is expected to continue for several weeks. So far, more than 3 million people have received at least one dose of either the Oxford AstraZeneca or Moderna vaccine.
In the meantime, the University of Lagos has since resumed and exams are ongoing. This was after shutting down when 3 students contracted COVID-19. There was fear, anxiety over how students, were upset they had to leave without much notice. But to talk more about the events and what is happening now in the school, joining us, of course, is the Deputy Vice Chancellor, DVC Academics and Research, University of Lagos, Professor Oluwole Familoni. He joins us here in the studio. Thank you for joining us on the program.
Thank you very much for having me.
All right. I'd like to begin with, what we saw, shutting down abruptly. Was that the best decision at the time?
Thank you very much. When this case of COVID-19 was discovered by the university, we tried to curtail it by trying to ask the student to hibernate, but the number of students going to the internet was enormous. And some students have started thinking that the university management was trying to cover it up, whereas we are not doing anything like that. We are trying to see the best way to do it orderly so that they can go without any trouble. But when the number of internet work on, people are talking about it a lot, and we thought that we should take the right decision. We took it to the Senate of the university, and we have a lot of doctors in the LUT, and it was discovered very robust, and we decided that the best thing for us is to ask them to go home and then isolate in their homes, because the number, like you have said, is very few. But when people are in one room, then everybody in that room will be subjected to that. That's why we said to prevent it from further increasing, the best thing for them is to go home after seen the pros and cons.
But even the NCDC, the Nigeria Center for Disease Control, said that they were not happy with the way the University of Lagos handled it. I mean, in their guidelines, they talk about when there's an outbreak, there should be a committee in school, and this is to drive surveillance and the response. And perhaps everybody should have tested before, you know, asking students and staff to leave the premises.
The only students were asked to leave the premises. We tested them, and we told them that it's not as severe as people are making it to be. It is just hyping it. That was the situation. NCDC were not happy with us before, but when we told them the situation, that whether they would prefer that 10 students of the University of Lagos drop dead, whether they would prefer that, and from the letter they wrote to us recently, they told us that they were happy with the action we took, and they find that when they got the information that we have, then they were sure, they said what we did was okay and not as bad as what they thought. No, if you depend on social media, you can go to take a wrong decision.
So let's fast forward to now. School is open, exams are ongoing.
That's right.
If there's an outbreak today, is the University of Lagos ready for it?
Yeah, before we resumed, we had contact with NCDC, Lagos State University, or Lagos State government, and LUT. Before we were able to resume, we had assurances of LUT, our university hospital, and the Lagos State assured us of Bagada General Hospital as the hospital that they can give to us in case of any eventualities, which we are not praying for.
So in terms of the COVID-19 response committee in place, is there one in place?
Oh, of course. One has been in place since the beginning of the pandemic. And we have several committees of different types for online teaching. That's one. COVID-19 response committee, and any other thing that could have come up, we are more than ready. And we have taken a lot of actions to make sure that nobody is going to the halls of residence without masking up. We ask each student to bring minimum of 500 ml sanitizer, about minimum of 10 face masks. They are going to be in school for just about 10 days. So we hope that if they use one per week, per day, and that should be sufficient.
So there will be monitoring of the non-pharmaceutical protocols on campus.
Yes, that's the cheapest way to set yourself away from COVID-19.
Looking at what happened, and this is before, during the shutdown, before shutting down, do you think that students were adamant to the non-pharmaceutical interventions?
Maybe they were, but if you saw the way when they were asked to go home, everybody was wearing his or her mask, and they knew that it's a serious matter. Coming back, everybody is taking all their best action to make sure that they put on their mask, and the security men, porters, lecturers, all of them have been tutored that they should not allow people to enter without putting on their mask, because that's about the best way to do. And if anybody is coming to an exam room, we ask each person to sanitize, not their own. The school provides sanitizers. If not, they may not be able to afford that.
Finally, in terms of vaccination, which is ongoing across the country, is that taking place? Is there a site in the University of Lagos?
Yes, we have a very big hall called Jelilo Motola Hall. We have vaccination going on there for our students, for our staff who may have not taken vaccination. Before this, a lot of our staff have taken the vaccination, and currently it is ongoing. If you have taken AstraZeneca before, there is, and the new one is also available. So whatsoever type you want, we have courtesy of Lagos State government.
All right. We wish, of course, the University of Lagos the best in all that you do. Thank you so much for joining us on the program. Deputy Vice Chancellor, DVC, Academics and Research, University of Lagos, Professor Oluwole Familoni. Thanks again.
Thank you very much for having me.
Multilateral Leaders Task Force on COVID-19, MLT, including the heads of the International Monetary Fund, World Bank Group, World Health Organization, World Trade Organization, in a meeting with leaders of the African Vaccine Acquisition Trust, AVAT, Africa CDC, Gavi, and UNICEF, say that the crisis of vaccine inequity is driving a dangerous divergence in COVID-19 survival rates in the global economy. While appreciating the important work of AVAT and COVAX, they say the global rollout of vaccines is progressing at two alarming different speeds. According to them, low and lower middle income countries, the majority of which are in Africa, simply cannot access sufficient vaccine to meet even the global goals of 10% coverage in all countries by September and 40% by end of 2021, let alone the African Union's goal of 70% in 2022. They're calling on countries that have contracted high volumes of vaccines to swap near-term delivery schedules with COVAX and AVAT. They're calling on manufacturers to immediately prioritize and also fulfill their contracts to COVAX and AVAT. They're urging G7 and all dose-sharing countries to also fulfill their pledges urgently. They're asking for support for ancillary supplies, saying that barely 10% of nearly 900 million committed doses have so far been shipped. Well, joining us to talk more about this on the program is Dr. Githinji Githa. He is AMREF Health Africa Group Chief Executive Officer, and he joins us virtually on the program from Nairobi. Thank you for joining us.
Thank you very much, and thanks for having me.
Great. You've made outstanding contributions to the health sector in your work at the helm of AMREF Health Africa, among other positions. What's your take on how African governments are fighting the coronavirus pandemic?
Well, my take is that the African governments have struggled, but with the best intentions. We've seen that African governments struggled very early on and closed their borders very early. They had a very robust response. But then again, as we say, the virus was always several steps ahead of everyone, and it was so in Africa as well. And therefore, the governments have spent their time chasing the virus, so to say. And that has not been very easy, though the guidance of Africa Centers for Disease Control and Prevention, which is a part of the Africa Union, has been actually instrumental in the continental response. You know that when we got Ebola a few years ago, we did not have an institution like the Africa Centers for Disease Control, or Africa CDC. And we have seen the value of that institution now with the pandemic. So I would say that it has been a very commendable response to this pandemic this time around.
But for you, what would you say the biggest challenge was or is for some of the countries?
I think for across the continent, the biggest challenge has been how to balance lives and livelihoods. Because we know that 80% of Africans work in the informal sector, meaning that when you actually take the measures that were earlier advised, which was about lockdown or partial lockdowns, and even curfews, which are still holding a lot in many countries, then you're left behind with a fractured economy, a fractured social fiber. And how do you decide when livelihoods are more important than lives and vice versa? You know, lives are always of value. But then we have seen unrest in some governments, in some countries, because people are hungry and they are socially under pressure. We've seen mental health illnesses rising. We've seen gender-based violence rising. And these things are rising because of the measures, the public health measures, which are well-meaning, that are being taken. So this has been the biggest challenge. And you've seen governments, titrate, moving from a bit of curfew, a bit of lockdown here and there, then moving back. And many governments now, because of course there is widespread community spread, have actually abandoned lockdowns or serious cessational movements and have remained with limited measures like curfew, but allowed business to go on, the informal sector to go on. The markets are open, the schools are open. So this has been the biggest challenge. But then, of course, there has been the challenge of resources. That because we don't have universal health coverage in the continent, people who get admitted because of COVID, they don't know who pays for it because we don't have social health insurance in the continent. So people have been left with huge bills. I was talking to someone today, a governor of one of the counties in Kenya, who said on average it's costing about $6,000 to treat a COVID patient for 2 weeks. when you actually look at a continent without universal health coverage, that means people have to dig into their pockets, sell their livestock, sell their land, and therefore health itself, COVID itself, is creating poverty by admission, even beyond the socioeconomic measures. So this is the other challenge of resources and a fractured economy. But finally, vaccines, that we can't access them, and therefore the final point of control of the pandemic, which is vaccinating as many people as rapidly as possible, Africa has been left behind through vaccine appetite, through measures that are completely unacceptable, where countries are adding the booster doses, they are vaccinating low-risk individuals, individuals, yet Africa has not even gone beyond the 3% of its population to be able to provide some form of response and safety measures for its population. This is now going to be the next battleground for vaccine equity for this continent.
Dr. Gitahi, can you blame them? They have the money, they can afford to, and they want to safeguard their population. Yes, you've also been of the view that vaccines are like safety belts, which doesn't necessarily stop accidents but confer protection. I mean, in terms of production of COVID-19 vaccines, what is delaying the continent, Africa, from producing it? And this is looking at the future of a pandemic that we're going to have to live with.
Well, Africa has not had a history of manufacturing vaccines. We know that Africa manufactures only 1% of its current consumption of childhood vaccines. And that 1%, and of course, including some adulthood vaccines like yellow fever. The reason for this has been obviously resources. Africa's population is 17% of the global population, but the economy of Africa contributes about 2% of the global economy. Now, this means that actually Africa's and African continent is resource poor in terms of the GDP. We can argue about all the other political issues about the resource flight and also governance, which is obviously a big challenge, where resources may not be harnessed because of governance challenges. We can talk about unexploited resources, and we can even talk about post-colonial exploitation of the continent. But let us talk about what we know and what is here now, that Africa has a small economy for its population. And therefore, even when you look at the health sector, which ideally should be the one that is going to finance absorption of commodities like vaccines, if you are to take the tax level, allocate the health budget to individuals, Africa ends up with $50 per person per year. Compare that with $4,000 per person per year in the UK, $10,000 or $5,000 of public money in the US. So we have no money. So that's the first thing, that there is no money to do large-scale vaccine manufacturing. But there is also another problem, that because of this lack of money, the world has found a mechanism called the Global Vaccine Alliance, which delivers vaccines to Africa through what we call Gavi. Africa is the biggest recipient of vaccines from UNICEF that distributes vaccine globally. 60% of all vaccines by UNICEF are delivered to the continent. Now, the challenge we have is because of the resource poverty, there has not been industries that have been developed for this. And even if we have developed industries, there is a challenge of supply of market dynamics, because the biggest purchaser of vaccines for this continent would have to be the Global Vaccine Alliance for now, because countries in Africa, which are fragmented individually, none of them can sustain a full vaccine manufacturing capacity. So basically what I'm saying is that, to answer your question, for us to achieve full-scale manufacturing in the continent, we need resources to begin with. Those resources need to go to research and development. Then the resources need to go to manufacturing and buying raw materials. But eventually, we must ensure that the continent has a market-shaping strategy to ensure there is a common purchase mechanism for vaccines for distribution. No single country in Africa can sustain large-scale manufacturing of vaccines if it's not exporting to the rest of the countries. So Africa will require the countries to come together through the common free trade market, come together through a common vaccine and medicine regulatory agency that is being discussed by African Union, so that eventually we have a common market and a common distribution framework, common regulatory framework, and a common purchaser to distribute. And that could be African Union, or could be Gavi, or could be whoever else and needs to organize it. So it's a complex issue.
All right, indeed a very complex one. Thank you. Ever passionate about healthcare, universal healthcare in Africa. Thank you so much, Dr. Githinji Gitahi, Amrev Health Africa Group Chief Executive Officer. Thanks for joining us on the program.
Thanks for having me. Thank you. Stay safe.
You as well. South Africa's National Institute for Communicable Diseases has reported the identification of a potential variant of interest called C12. Here's more on the global update.
Scientists in South Africa are monitoring a new coronavirus variant that has been slowly spreading through the country. The variant, known as C12, was first identified in May and has not yet spread enough to qualify as a variant of concern. However, scientists have observed that C12 appears to mutate almost twice as fast as other global variants.
Exact threat from this variant, we don't really know yet. We're not at the stage of fully understanding that. The reason we were worried about the kind of combination of mutations was that many of the mutations we see in this C.1.2 are the same mutations we've seen in some of the other variants of concern, particularly the beta and the alpha and the gamma. But it's in a different combination.
Professor Penny Moore there, a senior scientist of the body, saying that the C12 was at low frequency currently, between 2% and 3% of infections. Also watching the COVID-19 update program. For more updates, take a look at our website. It has the latest on the pandemic. You can find some of those topics in real time. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.